Access to healthcare is a major concern for people around the world. According to the World Health Organization, the highest attainable standard of health is a fundamental right of every human being. This right to health means that the state must create conditions in which its population can be as healthy as possible, but each state approaches this issue in different ways. In the northern part of the Americas, for example, each country allocates different percentages of its spending to healthcare, with the US spending more as a percentage of GDP than any other country in the region. This can be broken down a different way to show the actual spending on healthcare per capita. 54% of total healthcare spending in the United States is private, which means it's mainly paid for through private insurance or out-of-pocket spending by individuals. Both Canada and the United States have a comparable amount of doctors. For every 10,000 people, Canada has about 21 doctors, while the US has 25. However, the number of doctors per person in Cuba nearly triples those in Canada and the US, with 67 doctors for every 10,000 people. A somewhat different situation appears when we look at number of nurses and midwives. All three countries show comparable statistics across the board. However, the United States spends a lot more than Canada or Cuba on healthcare. One common argument that is made against universal healthcare is that it is too expensive and is a burden to the state. However, in the case of the two public systems of Canada and Cuba, they managed to show comparable, if not better results in certain healthcare indicators and spend considerably less.